Hi, my name is Dr. David. I'm a neurosurgeon that specializes in pain management. Today's topic is how to release shoulder pain with physical therapy. It's quite a complex problem to solve shoulder problems, and in our clinic, we perform many kinds of injections and prolotherapy. But in this video, I will focus on physical therapy. I will tell you about a patient story to all of you, and you can feel that there are lots of similarities between this patient and people around you who suffer from shoulder pain. She suffers aggravating left shoulder pain for a month. Also, she was unable to reach her back with her hand due to pain. On physical exam, there was definite tenderness on the long head of the biceps. Our physical therapist performed physical therapy on the biceps long head, subscapularis, infraspinatus, and supraspinatus muscle, which dramatically reduced the pain. I'll tell you about the anatomy of shoulder for 50 seconds briefly. On the front view, you can see short and long heads of biceps tendon. Also, subscapularis muscles are here. On the back side, supraspinatus, infraspinatus, and teres minor muscles can be identified. Well, due to problems such as impingement or trauma to the tendon, the muscle's range of motion, which called ROM, decreases slowly, and at some point, patients escape from pain provocation movements, leading to the functional deterioration of affected muscles and the overuse of unaffected muscles. As a result, all muscles become inflamed, and due to limited muscle function such as stiffening and stricture, the shoulder joint and capsule becomes overburdened and inflamed. This also accompanies shoulder instability and mallocation, also known as a subluxation of the shoulder. This is why patients have not only a single muscle or joint problem, but a global problem with their shoulder. Finally, it makes sense to treat all of these structures to cut vicious cycles. As you can see on the image, the biceps long head runs between the intertubercular groove, and the inflammation or shortening of biceps tendon can lead to difficult external rotation of shoulder. This means this abnormal humeral angle can lead to abnormal movement and persistent tension to other muscles mentioned before. So by releasing the tense stricture of tendon, we can help break this vicious cycle. From the previous image, you might have noticed that the biceps tendon problem can cause your arm to turn inward. So to stretch the tendon, try turning your arm outward, like this image. There are many ways to release the biceps tendon, but I recommend two movements. First, externally rotate your humerus like this image. This is easy to follow and also helps the subscapularis muscle to release. Second, place your palm on the wall and make sure to fully stretch your humeral head while externally rotating it. Hold this position for 10 seconds, 4 times a day. This physical therapy can be done by yourself and it's highly effective. So please follow this method for the health of your shoulder. Well, in my case, exercise therapy at supraspinatus muscle temporarily reduced pain, but the patient was unable to fully recover and experienced recurrent flare-ups. The presence of pain in the anterior shoulder region and significant pressure on the supraspinatus muscle suggests that the supraspinatus muscle was prone to anterior impingement. There's a report that the biceps long head is flattened. Impingement and flattening are likely the result of tissue repair due to mechanical stress. In other words, it is due to the concentration of biomechanical stress on the shoulder joint. When the arm is raised, the biceps long head and rotator cuff muscles work to stabilize the shoulder joint and have a mechanical compensation relationship. If the rotator cuff function is impaired and the biceps long head is unable to trace a normal path during shoulder movement, the stress on the biceps long head will increase. In other words, it is believed that the present case is a state in which the function of rotator cuff is impaired or the range of motion of lateral rotation is limited, resulting in stress on the biceps long head. Therefore, we approach the rotator cuff muscles. There's a report that direct stretching of the infraspinatus muscle, shown here, improved pain and range of motion in patients with scapular ringing. In addition, we injected botulinum toxin into infraspinatus muscle of a patient with scapular ringing and performed a panel block to suppress muscle spasm in the infraspinatus muscle, resulting in improved range of motion. However, the patient's pain and ROM did not improve significantly after 6 months of exercise therapy. Therefore, we changed the exercise therapy program to focus on the biceps long head, and the patient's pain was relieved. However, the patient experienced recurrent pain after returning to pitching, so we changed the exercise therapy program to focus on the rotator cuff muscles. First, this is subscapularis exercise. The lower fiber of subscapularis can be stimulated from the posterior direction. By observing the movement of this area with ultrasound, it can be seen that the muscle contracts and the belly bulges outward due to the contraction. Therefore, when stretching the subscapularis, it is better to push the muscle outward from the lateral edge of scapula towards the subscapularis. To promote muscle contraction of the supraspinatus and infraspinatus muscles, it's good to directly stretch the lower fibers of the supraspinatus muscle by pushing it towards the scapula, as if pulling it out of the acromion. This is the contraction of supraspinatus and infraspinatus muscle. During lateral movement, observation with ultrasound shows that the distal end of the supraspinatus muscle is pulled towards the lower scapula. The horizontal fiber of infraspinatus muscle also pulls towards the center of vertical fiber, so during lateral movement, it is good to guide the scapula downward with the thumb and guide the horizontal fiber of the infraspinatus muscle towards the infraspinatus side with the other finger. By observing with ultrasound, it can be seen that the infraspinatus muscle contracts in a similar way as the supraspinatus muscle during external rotation of the shoulder joint. Therefore, during external rotation exercise, it is helpful to guide the transverse fibers of the infraspinatus with the fingertip towards the inferior side. Well, this is all I prepared today, and if you felt that this video is full of contents and useful for yourself, please subscribe my channel and watch the next video. Thank you very much.